Hello and welcome to the 20-minute consultations. And I'm Mark Rickenbach and I've got 20-minute appointments as a retired GP. And this is Jonathan Ryle, who is at Watership Down Practice and has all his patients and all doctors consulting at 20-minute appointments. Now we know that longer consultations are associated with more patient-centeredness, with reduced prescribing, with more psychosocial support, less follow-up, and more prevention, among other things. But there are several models existing already, including training. There is minor operation procedures, which need longer appointments, double appointments for complex patients, and some practices offer a range of appointments from 5 to 10 to 20 minutes. In our practice, we have one doctor doing 20-minute appointments. And I want to hear a little bit more from Jonathan about Watership Down and how his practice has got to 20-minute appointments for everyone in the practice. So over to you, Jonathan. Tell me a bit more about it.
Well, thanks for inviting me, Mark. So yeah, this actually all started, so pre-pandemic, we were doing about 13-minute consults. So all the doctors, so we did 3 10-minute consults with a 10-minute break, and that just allowed us to do about 13-minute consults, which worked well at that point. But as soon as the pandemic hit, we had to rethink the model, as all practices have had to do. And so during the first lockdown, we were sort of muddled around as best we could with telephone consults and very limited face-to-face. But then when we started going back to more face-to-face consults, it made sense that the model that we had was not going to work. The reason being that we didn't want lots of patients in the waiting room. We had to allow time for donning and doffing of PPE and room cleaning and airing. So we came up with a model of the 20-minute consult, which just allowed us more time for all of this stuff. But as a lot of that sort of settled down and we weren't spending all the time putting on all the PPE, and we're having more patients in the waiting room, actually the model stuck. And the reason, being is for all the reasons you've just explained, Mark. Going on the ethos of every contact counts, actually, it made sense to spend more time with these patients to reduce the number of consults they might require, especially given that we've had a lot of time where patients haven't been able to, or felt like they haven't been able to contact us or see us. And so actually when they were coming with slightly more complex conditions, more complex issues, more psychosocial stuff. And actually 10 minutes, 13 minutes was just not enough time. And so we made it a blanket policy to have 20 minutes, and we've continued that since then.
That's amazing. So you've managed to do that, and I found it really helpful to get patients to spend a bit more time with them. But what were the disadvantages for you? What was the problems? Because presumably you've had to take a reduction in pay or reduction in patient numbers.
Yeah.
As a retired doctor, I can afford to do that, but how do you?
So definitely there has been a reduction in patient contacts, and we have felt that, and it has probably put slightly more pressure on the duty sessions, which is unfortunately one of the consequences that have come from it. At the moment, we're sticking with it because it's working well, and we feel it really is best for our patients that need to be seen, that we can spend more time with them. And also, if we can spend more time, then hopefully we can reduce them phoning up again, which then leads to another consult. So at the moment, the patients can't directly book a face-to-face. So essentially, it's 2 consults. So if you can reduce that, then actually you're saving time in the long run. There probably has been some financial repercussions to the practice, but I think that the practice's priority is patient care, not the finance parts of it. So I think that's the patients have got the better deal.
Oh, that's fantastic. Well done. I think that's a real achievement. For me, it's made a big difference. I've been able to spend more time with my patients. I feel less pressurized and less stressed from that. And it's made a dramatic change. My biggest problem is actually showing my partners I'm doing the same as them. And perhaps because I'm in the surgery a bit more, taking on more. But I think doing it across a whole surgery is fantastic. So thank you, Jonathan, for that. Really fascinating. And I hope everyone found that of interest. All the best. Bye-bye.
Bye.